there are these two people who are, walking along a river. They notice that somebody is in the water and they're crying for help. One of the people jumps in the water, swims over to them and gets them and saves them, brings them back to shore. And then they hear another cry. The person jumps back in the water, swims back out to them, grabs them, brings them to shore and saves them. And they hear another cry and another and another. And he keeps running, going back in the water and swimming and saving these people. And he finally turns to his friend and says, "Why aren't you helping? Come swim out and help me save these people." And he says, "I'm going to go upstream and figure out why all these people are falling into the water."
Hello, and welcome today to Executive Connect podcast. I'm excited to have my friend Becca Yanniello here with me today. Thank you so much for being here today, Becca. I'm so excited to have you with me today. And I love talking about health and what we can do to better our children and other leaders in our organization. So just kicking it off with the first question I'm curious about your perspective on is, can you explain the difference between public health and traditional healthcare today?
Yeah, so this is a really great question. I think a lot of folks out there have heard the term public health, and they're very familiar with healthcare and how it's delivered in the United States. But the difference between public health and healthcare can sometimes get lost. So public health is a field of science that essentially looks at what makes people healthy and what makes people sick, what keeps people healthy, and uses that information to guide policies and laws and services to support the health of populations and groups of people. So traditional healthcare, particularly in the United States, really focuses on responsive medical care and what doctors and nurses and hospitals do in treating people once they get sick. Now, there is a component of preventive medicine, which is like preventing long-term chronic conditions and things like that. But public health looks at not just how do we prevent disease and health issues and injuries, but also what keeps people healthy and really trying to do more of that and removing the risks to our health at a community level, at a policy level, at a national level. So, while doctors and nurses treat one patient at a time, public health looks at groups of people, looks at everything from communities to cities to states to the entire nation, and how do we do our best to give everyone the chance to be healthy and give everyone what they need to be their healthiest.
That's fantastic. I'm curious, what are included under the umbrella of public health?
So public health is a really big umbrella, and it covers everything from policies, regulations, and laws to health education, science communication, services and programs. So it's and research as well. So it's a really, really broad field. And what I love about public health is it really looks at the context for what we typically think of as our health. So it can include everything from our social relationships to what's in our environment, how we relate to each other, the information that we have and how we make our choices, and also, what we know about the field of medicine and what we know about what is going to keep people healthy and trying to make that accessible to everyone. So while we know, for example, that going to your doctor is important and doctors need to be able to provide that medical care that they do, public health looks at how do we make sure that everyone has access to those doctors and access to the hospitals, access to emergency care. So, it's kind of taking medicine and trying to contextualize it at a broad level.
Yeah, I didn't really pay too much attention or realize the difference personally. I just grew up focusing on my health and what I could do to be healthier and eat my vegetables, as my parents used to say. And then I got older and realized that most people, it's not common to focus on eating well and, taking care of yourself it's a learned skill. And I feel like it's also a taught skill. And most times people don't realize they need to take care of themselves until they go to the doctor and realize something's really wrong. So I love, and I know you wrote a book about this, but as it pertains to public health, like, why is it so important to the world today?
I think the pandemic really brought public health to the public eye, because a lot of public health work goes on in the shadows, essentially. So I think that we all realized the importance of taking care of like everybody and everybody doing their part to try to promote health. I think that, right now there are so many things in our society that contribute to whether or not we're healthy or whether people are healthy, and it also, there are disparities in health as well. So we know that, poor areas have worse health outcomes than more affluent areas. They even say, which is, there's a lot of research on this, that your zip code is actually more influential than your genetic code in your life expectancy and your health outcomes. And so I think it really is important for us all to be educated about what it is that keeps us healthy, and all of the things that go into public health. And public health doesn't only focus on viruses and bacteria and diseases, but public health also looks at social influences, environmental influences, and how those things also shape our health and well-being. And thinking about health as more than just, your blood pressure, but thinking about it as your overall state of well-being, like how you feel mentally, how you feel physically. Are you thriving? Are you under a lot of stress? And what that does to your health, and how it all plays together. So I think it's important for everyone to kind of understand these influences and then be able to make more informed decisions about how to promote their own health and how to support other people in being healthy too. I wrote a kid's book about public health to also kind of bring awareness to the fact that this affects people across their lifespan, for children, babies, pregnant women, all the way through end of life. There are so many things that impact our health, and things that we don't necessarily think about, right? So being able to have clean air. There's a recent study that came out of the University of Chicago indicating that air quality is actually one of the biggest public health issues in our generation, because of air pollution, because of wildfires, because of lots of different things that are impacting air quality. And they're really finding out that air quality has a significant impact on our health and on disease processes, on different disease states, not just asthma, for example, but also like more other chronic conditions as well that go into adulthood. So there are lots of things that we can open our eyes to, in general, and learn about. And I think that can also really influence how we live our lives and how we look at health and how we keep ourselves healthy. So there's a lot of substance there, right? I mean, and also the world is changing, as we know. I mean, even if you think about everything from the, like homelessness or technology and using our cell phones so much, and what that's doing to us. I mean, there's so many different things going on in society that are constantly changing and evolving. And public health looks at how all of those things are influenced and how those things are influencing our health. So it's a constantly changing field.
Are you someone with a demanding job, but tired of the 9-to-5 grind? What if you could build a profitable side hustle without sacrificing your full-time career? Our new partner, Book Profits, can show you how to turn your limited free time into a thriving online business. Learn how to find, sell, and profit from used books, all on your schedule from the comfort of your own home. Not crazy tech skills needed and no major upfront investment, just simple strategies that fit into your busy lifestyle. Visit the URL on the screen for a free training today and learn more. Yeah, I was just thinking about myself personally. In Texas, it's like 106 degrees, and it's heavily influencing my health and, my energy levels. And I know here in Texas, we've had a ton of people that have never had allergies that now all of a sudden have allergies, myself included. I've never had a day of allergies. And now I'm like, am I getting sick? And it's not that I'm getting sick. It's just allergies because of, like you mentioned, the air quality here has changed. There's a lot of changes from just the weather alone that's
Mhm.
affecting people's energy levels. What can I do or what can we do as a community to support public health?
I think it starts with learning about about public health, and I mean not necessarily becoming an expert, right? But just kind of broadening our perspective about what health means, right? I mean, like you said, it could be everything
Absolutely.
from how your environment impacts your ability to exercise or go outside and or relieve your stress through your normal, like going for a walk or going for a hike or whatever that may look like. Just really starting to kind of open our eyes to all of the different things that impact our health. I think that's a starting place. And then also, I think that public health is really, in some ways, it's like this grassroots, like slash social justice slash like just context for life, right? I mean, thinking about what could be better, what is going on in our environment, what is going on in our lives, what is going on in our communities, in our offices, in our professional lives. How are all of these things impacting people, and what could be better? I mean, I think that that's the challenge of public health, right? I mean, there just like in medicine, there are constantly evolving diseases. Like COVID, for example, came out of nowhere. And the research, there's always more research coming out that's helping us learn about what we can do to prevent disease, or what we can do to help influence that, or medicines that come out. And in public health, it's kind of, it's similar, right? It's like always understanding what's going on around us, and how that's influencing us. Even things like, I was having a conversation the other day with a woman who's an ophthalmologist, and she was telling me that children now are having more myopia because they're looking at screens so much, and that the remedy for it is being outside, because when you're outside, your vision has to change between looking in the distance and looking up close, and your eyes are constantly, and your brain is constantly accounting for that, and it's challenging your eyes a little bit. But when you don't have a lot of that, and you're only looking at two-dimensional screens for like the majority of the time, it can actually influence the way your eyes develop as a child. I mean, these are things that, like, who would have thought? But this is another way
Right?
that technology is influencing us.
So true. And I'm so glad you said that because, personally, I go from call to call to call to call every day. Like so many people that work, from their home these days, or even in an office, we're all on Zoom calls and Teams calls. And I have to remind myself to my eyes to look
Mhm.
away from my computer because I'm not sure I believed in the Zoom fatigue, but I will tell you now, I definitely believe in the Zoom fatigue for my eyes and my body and the way I sit. And so it's so true. But I always tell my kids at the end of the night, I'm like, give me your phone or your iPad. And I'm going to take it away so your eyes can readjust before you go to bed. And I think it's something, you're right. We don't even think about. It's just, our kids today I know my kids have laptops that they do their homework on, and they're on screens all day at school. And so I love that you said to go outside, because it makes me feel like I'm, doing the right thing. I'm like, go outside, talk to somebody, talk to somebody else but the computer. Because it's true. We don't think of those things. We think we're doing the right thing. And so I think it's being mindful too, right?
Mhm.
And reading some of these things. I know every year I set my goals at the end of the year, and one of those always every year is health. Like, what can I be doing better for my health? Or And one of the things that you mentioned, cell phones. Like I'm around multiple computers a day. I've, a personal phone and a work phone, and
Mhm.
just putting my electronic device and the TV and all the things down and walking away from it and stepping outside. So that is a huge win I've noticed just for my own mental health and well-being that I've had to force in my life. And so just with that, like what can we do, adults, kids, people in other countries, everybody, what can we do and where can we go from here from your perspective?
Yeah, that's a great question. I think there's so much work to do. Again, I think it starts with learning and just being mindful and aware, like you said, and kind of shifting how we think about health, and our mental health, and how all of these things play together. And then I think from my personal perspective and my focus in public health and population health, my bias is, I think, like understanding the disparities, understanding why some people have more health issues than others and what's behind that, and how can we help mitigate that, how can we reduce those risks. I think so. There's a parable that's like really commonly told in public health. That's, I don't know if you've ever heard it. It's like called the like it's like this river story, where there are these two people who are walking along a river that's like a rushing river, and they notice that somebody is in the water and they're crying for help. And so one of the people like jumps in the water, swims over to them, and gets them and saves them, brings them back to shore. And then they hear another cry, and the person jumps back in the water, swims back out to them, grabs them, brings them to shore, and saves them. And they hear another cry, and another, and another, and he keeps running, going back in the water and swimming and saving these people. And he finally turns to his friend and says, why aren't you helping? Aren't you going to come swim out and help me save these people? And he says, I'm going to go upstream and figure out why all these people are falling into the water. And that's what public health is, right? So it's like thinking about things differently, not just how do we remedy like sickness, but like how do we just live our lives in a way that prevents it to begin with, right? Like what can we do to give everybody the chance to be healthy and be their healthiest? And I think part of that is opening our eyes, and part of it is understanding the disparities, like why women have certain health outcomes that men don't, and why are some groups of people, like some women have worse like pregnancy and birth outcomes than others. What's behind that? Why is that? Like that's clearly not fair. What can we do as a society to support that and make the playing field a little bit more level? So I think there are so many different things we can do, right? But it's just, I think generally it's just about kind of opening our eyes and learning about that. And I think that there is a push right now, particularly for adults, like in the workplace, to thinking about work wellness and about people's mental health at work, and how can we be mindful of that work-life balance, and understanding that the way that we are balancing our lives will impact our health, or even just like you said, even ergonomically, like how are you sitting at your desk, or how your teams are feeling, or what you're like, whether you're inside all day every day, and all of those things too. So there's so many different places to go. And for kids, I would say just learning. I think kids are so they're so smart, they're so creative and so smart, and they pay attention and they notice things. My kids are almost 2 and 3.5, and I'm always shocked at what they notice and what they see and what they remember, and I think kids can connect dots that we as adults can't, because we've always lived, we've grown up to think a certain way about problems, about what we see in our environment, about, how people react and relate to each other. And I think kids bring such a fresh perspective. And I think even just giving them information and talking about things can really help kids, become really, astute observers about what's going on around them, and also kind of come up with creative solutions.
Looking to get paid speaking gigs, but you don't know where to start? The Speaker Lab has helped thousands of people build real profitable speaking careers with their proven system. Right now, you can grab their free one-page speaker success blueprint. It lays out exactly how to launch your speaking career and start booking gigs that pay today. Plus, you'll get invited to a live masterclass where Dan Irvin shares the 3 secrets top speakers use to earn an average of $16,000 plus per gig. Get your free blueprint at thespeakerlab.com/executive connect. I have like 5 health buckets that I focus on. It's, what am I putting in my body? My exercise, expending, my any kind of activity. So I do different, yoga, and I do HIIT workouts and walking and all those things. But then, the third part that I pay attention to, you nailed it, is like I always say, is there such thing as balance? And, I always shoot for a balanced meal and a balanced life, and everything's got to be in balance. But mindfulness on your emotional health. A lot of times people say, are you okay? And I'm like, oh yeah, I'm okay. I'm great. Everything's great. And I'm saying that, but I'm not looking like, I forget who, I think it was maybe my husband that said this to me. You should tell your face that you're okay. I'm like, okay, face, we're okay. Right. And so I think, the emotional side, like we talked a little bit about, and then just, I always say, like, one of my favorite sayings is carpe diem, and seize the day, and really, enjoy life, having that, don't live to work, work to live, and that kind of, those 2 approaches to life, and getting out and enjoying, your hobbies and your family and your friends. And so that side of it. And so there's kind of different buckets. I self-assess and make sure I'm doing the right thing. Any like top 5 things, or maybe let's call them life hacks, that people can do to, that maybe weren't raised with a mom that told them to eat their vegetables. Any like areas that you can suggest to people, like quick and easy ways that they can gain some personal wins?
Gosh, that's a tough one. It's like everybody's in such a different place, but I do think, you clearly are onto something. I think the things that come to mind are, when you think about, like, they have this like new Netflix show about blue zones, right? There are these places in the world where people live to be over 100 more than like the rest of the world. And like thinking about what it is that they have in common, I think can teach us a lot, right? To your question.
Yep.
So part of it is social connections. Like you were saying, just really also focusing not just on our work, but also on our families, on our friends and friendships, or just, practicing gratitude, or just, like having some kind of social connection can actually take a lot of stress away from people's lives, and can really enrich people's lives more than, specific accomplishments. And I think that one of the things that they say is like common in these, communities where people like are really, healthier and live a long time, is their social connection. Also, obviously, like eating well and exercising. I think exercise is so important for so many different reasons. We live in a society that's like very vain, right? So like there's the exercise, there's this like association with exercise and like the way that we look, but it's also very functional, right? To be able to grow older and be able to be independent and do things independently, and like lift objects and like reach for things, and, not fall easily. There's so many things that exercise does for us and our longevity. Obviously, trying to eat well. I think that not stressing too much, but, like trying to be healthy in those ways. And I think honestly, spending time outside, that kind of ties into managing stress. I think managing stress is so hard for so many of us.
Yep. Absolutely.
Particularly, professionals and professionals with families. It's very hard to balance it all, people with demanding jobs. But I think that managing stress is critical. I mean, stress is so toxic for us as human beings. Like stress is associated with all kinds of bad things that can happen to our health. It raises our blood pressure. It can, increase our risk for heart disease. It can lead to, weight gain, which has its own issues, associated with obesity. So, I mean, there are just so many things that stress does. It also ages us faster, like on a genetic level. So not to stress out about it, but like reducing our stress is I think a huge one, though it's probably the hardest. So, and it looks different for everyone, right? I mean, everybody has different outlets.
Yep, so true. So that I'll be adding that to my list now, Becca. Reduce stress, live longer. Because we don't even realize it sometimes. Like the stress is going. You mentioned it earlier with the weather, the seasons, how that impacts our body, or not sleeping, and all of it's tied together. It makes me think I need to add stress, and that what's my scale from 1 to 10. And so I love it. Do you want to do a quick plug for your book and tell our listeners a little bit about your book and how we can find it and the name of it?
Yes, definitely. So I wrote a book called A Kid's Book About Public Health. It's published by Aarskaug, which is a publishing company that publishes books for kids about a lot of different topics that adults sometimes don't necessarily have the shared language to talk about with kids. My book it's short, it's easy to read with kids and discuss. It's for ages 5 and up. And it really is like an introduction to what we've talked about today. What is public health? Why does it matter? The fact that it's all around us and we don't even realize it. It's available on Amazon, Target, Barnes & Noble, and Walmart online. You can also find it through the Aarskaug publishing website.
Thank you so much for that. You make me think I need to make some changes personally. I love the information. I've shared it with my kids. They love it. We've had really good dialogue about it. For kids is always a challenge, right? Less sugar, more moving, less electronic time. So I know I am using it with my kids. It's been very helpful. So thank you so much for writing that book. Thank you so much for being here today. I love everything about what you're doing. I'm so excited to have you on again. And buy her book, follow Becca. She's got a world of information to take from. And thank you so much for being here today on the Executives Connect podcast. Have a great day.
Thank you so much for having me. It was a pleasure.
You've been listening to the Executive Connect podcast. If you have questions or ideas on how to bring leadership to the next level, email us at executiveconnectpodcast@gmail.com. And don't forget to subscribe so you can catch every new episode. Until next time.